doing healthcare research in Kenya is needed. Trust me, guys. According to the CDC, over 43% of the population are living in poverty. Kenya is facing a lot of healthcare challenges, high maternal and child mortality, high levels of infectious diseases such as HIV, tuberculosis and malaria. And there's an increased number of patients presenting at healthcare facilities across Kenya with mental health conditions. But it's not all bad. Despite this, Kenya is making massive improvements in most areas of the country. And so there are some really positive angles. But I think, if you're visiting Kenya and you want to do healthcare research, there are some key points that you should think about. If you're visiting Kenya and you want to come for a holiday, I would strongly advise it. It's an absolutely amazing place. I've been so many times. I would suggest going to Mombasa. The food is amazing. The beaches are, noticeably really, really good as well. But for today's video, we are going to be focusing on the research and how you can do good quality research inside Kenya. Hello and welcome to another episode of Leading Health. Thank you so much for connecting. Thank you for engaging and thank you for exploring. Amazing that, you're still here, still tuning in. As you know, I make videos every single week. Subscribe. Today, we are going to be exploring 5 considerations that you need to have when you want to do good quality international research inside Kenya. So all of these considerations have come from my own perspectives, my own insights of doing research in Kenya. Kenya is an amazing country, as you know. And when I did my research in Kenya, what I realized is that in relation to digitalization, Kenya is really, really developed. They've got some amazing stuff, like especially the M-Pesa. I mean, I don't think I even touched cash once the whole trip, which is, absolutely amazing. But for today, we want to focus on, the health care issues and, what you need to do when you want to do good quality research, especially healthcare research inside Kenya. So the first point is, you want to recruit and retain good quality staff. It can be very difficult to get the right people to help you deliver your research, especially if it's over a long period of time. And so it's really good to recruit the right types of people. Sometimes you get like word of mouth, this guy is good, this person is good, but you have to try and interview them to make sure that they understand what it takes to actually do the research properly. You might find it hard to get people, especially if they've not done research before at an international level. So from my experience, the research assistants that I recruited, they didn't always turn up, to be honest. Some of them turned up but didn't finish the work. So, I had a lot of back and forths. There was one lady who sort of called me up. She's like, hey, I've got this new connection. I'm going to collect the data at this really prestigious hospital. I need some more cash. I was like, amazing. 1 year later, I'm still waiting for that data. It never turned up, right? So, these are things that you have to contest with and you just have to keep going. Don't give up, keep going. It will happen in the end. Data quality and reliability. That's the second point that you need to take into consideration. You need to ensure that you're getting the sort of good quality, reliable data, especially when you're doing research in Kenya. Researchers, you need to be able to implement really rigorous data collection and methodology processes, and you need to make sure that everything is watertight, especially if you're aiming for, good quality publications and so forth and so on. To do that, I would suggest, making sure that you provide good quality training and supervision for all of the research assistants, anyone that's taking part in your research. This was something that I had a problem with as well. You really need to pay attention to the way in which the data is being collected to make sure that all of your research assistants are doing things possible. If you're only recruiting 1 or 2, then that's okay. I had like 5 or 6 So it was quite difficult. Keep your eyes open at all times. That's what I would say. The third point is around ethical considerations. It's really important when you're doing healthcare research to make sure that, you pay attention to all of the different rules and regulations. You need to ensure that you've got the informed consent from all of the participants. Make sure that confidentiality boxes are ironclad and tight. And also, manage those power dynamics. Make sure that people feel comfortable to take part in your research, especially when it's healthcare research. That's really important, right? So, I always adhere to all of the ethical guidelines because you have to, and make sure that I get ethical approval from my university and all of the locals, and every country has a different system. So it's important to know what it is before you get there. It's also important to make sure that you get all the clearance and so forth and so on. Guys, it's important to cover your back, right? At all times. You don't want to mess around with all the ethics, especially in healthcare. So just dot all the I's, cross all the T's, and you're ready to go. The fourth point is about limited research funding. It's really hard to secure funding for research projects in Kenya. It can be really, really challenging. Getting research grants and opportunities to do research in Kenya is very, very limited and very competitive as well. To be honest with you guys, I couldn't get research funding at first. I had to fund all of my research project in Kenya myself out of my own pocket. But you know what? I didn't actually mind because it was so fulfilling doing research in Kenya. And I felt to myself, okay, then this research is going to have massive impact for members of the public. So I was really happy to do it. And looking back on it 1 year later, it was worth every single penny that I spent. At the time, I was like, this is really stressful. But on reflection, it was really, really cool. The fifth point is around the bureaucratic processes and delays. Kenya has a lot of bureaucratic processes. You're going to have to navigate them, getting all the permits, getting all the approvals. This stuff takes time, guys. And so you have to be wary of that. You have to be ready to sort of play the long game. Take that into consideration when you're planning your journey to Kenya. Don't let it prevent you from doing your research. Allocate a little bit more time. The good thing for me is I actually have an academic colleague who works in London, but she's actually from Kenya. She was amazingly helpful. I just called her up. I was like, I'm going to Kenya to do research. Hook me up. And she actually put me in touch with some really amazing people, and they were really helpful. So thank you. I really appreciate it. Also, you need to utilize all of your connections. I have connections across Africa. I was calling people up in different countries to help me do the research in Kenya. And it was helpful, but it isn't 100%, right? I remember one person who promised me, so much access. I got to the airport, called the person, didn't hear back. Up to now, I don't know what happened, but, that didn't work. I was a little bit disheartened in that moment, but I was like, hey, I'm here now. Let me get on with it. I still pushed through. We still got it done. And, on reflection, it does pay off. So guys, you are going to face adversities. It's normal. It's research, but keep going. And in the end, it will pay off. 5 key considerations from my own experience of doing international research in Kenya. Give it a go. Overall, my experience was really positive. I met some amazing people, some amazing RAs. Some of them we're still in contact now. If you want to do research in Kenya, just let me know. I'm more than happy to assist you. I can connect you with all of the contacts that I made when I was in Kenya doing research. I think personally it's really important for more international organizations to come to Kenya and do research and to help to improve the healthcare system in any way you can. So I'm willing and able to help anyone that wants to come to Kenya to do research. Also, it's good to visit all of the tourist spots as well. Guys, thank you for connecting. Stay tuned for more.